here, go ahead and bring those feet in. You can bring those hands behind and try to get those knees down. You should feel a stretch here. Inhale, exhale. Option 2, you can push those down with your elbows. Inhale, exhale. And then a little challenge, bring your arms out, and then try to bring one foot up and hold for 5, 4, 3, 2, and then go ahead and switch. 5, 4, 3, 2, and then from here what we're gonna do is try to straighten this leg out, and then from here sit up nice and tall. Try to bend your knee a little bit. And I want you to try to feel it in the hamstring here. If you feel it behind the knee, that's not what we want to feel. We want to feel hamstring stretch. So it's really important that if you feel pain behind your knee or you feel any stretch behind your knee like this, that means that's your that's a nerve. That's actually a nerve. That's not a muscle. So that's why if you don't feel it here, then it's not the stretch we want. So in order to get there, you have to bend your knee, really sit up tall. Okay? Because if we go like this, we kind of take that whole stretch away. And then from here, what I want you to do is see if you can lift that foot off the ground and squeeze this top muscle here. Okay? We're gonna go up and we're gonna hold for 5, 4, 3, 2, and then slowly bring it down. Let's go ahead and switch it out. Again, you can bring your hands behind. See if you can straighten one leg out. Nice and control on the way down. Then from here, sitting up nice and tall. Again, slight bend in that knee. Unless you feel stretch in the hamstring, remember, don't straighten that knee all the way unless you feel it in your hamstring. Okay, we want to feel it in the hamstrings, not behind the knee. You're going to hold here, chest up, hinge forward, hinge. Try not to flex forward like that. Try to hinge forward. Hold, breathe, inhale, exhale. And then challenge yourself here. You can bring your hands behind your back to make it easier. Or if you want to make it harder, you can reach forward. We're going to try to get that heel up. Squeeze that quad tissue here and up. 5, 4, 3, 2, and slowly bring it down. Good job. All right, from here, let's just do some relaxed breathing before we end. So go ahead and close your eyes. Pretend you're on a beach. Inhale the fresh air. Exhale it out. So we're gonna do some relaxed sigh breathing. So what we're gonna do is we're gonna inhale, and then when we exhale, we're gonna go, ah. So we're gonna let all the air out, just like that. We're gonna go, ah. So we're gonna take an inhale, and then exhale, ah. Let it out. 2 more, just like that. Inhale, exhale, ah. 1 more, just like that. Inhale, exhale, let it go. And go back to your relaxed breathing. I want you to try to slow your breathing down. Almost so slow that you can't hear yourself breathe. So you're kind of like slowly inhaling, slowly exhaling. Remember, it's really important to inhale and exhale through the nose if you can control it, and also to keep your mouth shut with your tongue behind the back of the top of your teeth. I know it's a lot to say, but if you keep your mouth shut and keep your tongue on the roof of your mouth, it actually stimulates your parasympathetic nervous system, or it helps you become more relaxed. So when you keep your mouth shut, when you clench your tongue on your palate and breathe through your nose, it's actually going to help you be more calm, okay? So one thing you can do after this class is tell somebody in the chat what different body parts we used, Also, you can give somebody in the chat room, you can tell them that they did a good job, or you can share some good news. And then lastly, you can let me know how you feel physically. So how did you do during the workout? Okay, so that would be a way I can assess them at the end of a lesson plan for our lesson plan purposes. Okay, so being able to ask them questions. So what did you learn? What body parts did we move? Share some good news to somebody in class, and then also tell me how you physically performed. Tell me what your favorite exercises were, and if I had opportunity, maybe watching them and then giving them detailed response, but obviously we can't. So that's going to do it for today, everybody.